Hello, welcome to this lecture on anatomy of kidneys. Today we will discuss about the core anatomy of the kidneys, and their primary role is to filter blood and remove waste products and maintain fluid and electrolyte balance in the body. Thinking of the urinary system as a sophisticated plumbing and filtration network, it doesn't just eliminate urine, it carefully regulates blood pressure, red blood cell production, and the chemical composition of our body fluids. The major organs include kidneys, ureters, urinary bladder, and urethra. Today, our focus will be on the anatomy of kidneys alone, and later on, we will discuss about the anatomy of ureters and urinary bladder in upcoming lectures. So first of all, anatomy of kidneys. The kidneys are bean-shaped organs situated in the posterior abdominal wall, one on each side of the vertebral column. They lie retroperitoneally, meaning behind the peritoneum. Anatomically, they extend from the level of T12 vertebra down to lumbar 3 vertebra. The right kidney usually sits a bit lower than the left because of the presence of the liver on the right side. Each kidney has two surfaces, that is, first of all is anterior surface, second is posterior surface, and two poles, superior pole and inferior pole, also known as upper pole and lower pole, and two borders, medial and lateral border. The medial border of the kidney is where you find the renal hilum, the gateway through which blood vessels, nerves, and ureter enters. And the adrenal glands are situated on the upper pole of the kidney. Then kidney structure. The kidneys are well protected by multiple coverings. Starting from the inside out, the first layer is the renal capsule, which is a tough fibrous coat that directly envelops the kidney. Surrounding this is a cushion of perirenal fat, followed by the renal fascia, which is also known as Girota's fascia or perirenal fascia, which encloses the kidneys and the suprarenal glands. Then there is pararenal fat, which is mainly located on the posterolateral aspect of the kidneys. And this pararenal fat lies outside of the kidneys, providing the extra padding to the kidneys. As for the relations, the anterior surface is in close contact with the different organs depending on the side. For example, the right kidney relates to the liver, duodenum, and colon, while the left kidney touches the stomach, spleen, pancreas, and jejunum. Posteriorly, both kidneys relate to the diaphragm, psoas major muscle, and quadratus lumborum muscles. Here, this picture shows the outer coverings of the kidneys from superficial to the deep. First of all, there will be the renal capsule, then perirenal fat, then there is Girota's fascia, and then there is extra padding, that is pararenal fat. This is the then kidney structure includes the inner aspects of the kidneys, which include mainly two areas on which the kidneys are divided into the outer cortex and the inner medulla. The cortex extends into the medulla, dividing it into triangular shapes. These are known as renal pyramids. The apex of renal pyramid is called a renal papilla. Each papilla is associated with a structure known as the minor calyx, which collects urine from the pyramids. Several minor calyces then merge to form a major calyx, and urine passes through the major calyces into the renal pelvis, which is a funnel-shaped structure. From the renal pelvis, urine drains into the ureter, which transports it to the bladder for storage. At the tip of each pyramid is a papilla which drains urine into the minor calyces. These merge to form major calyces, which joins to form the renal pelvis. This is the important thing to remember about the inner anatomy of the kidneys. The renal pelvis, which narrows down into the ureter, and it have funnel-like arrangement, which is designed to collect and directly drain the urine efficiently into the ureters, which further drains the urine into the urinary bladder. And the medial margin of each kidney is marked by a deep fissure, which is known as the renal hilum. It acts as a gateway to the kidneys, from which the renal vessels and ureter enter or exit the kidney via this structure. And here it is the detailed structured inner structures of the kidneys are illustrated in this picture, which is showing the renal columns, base of the renal pyramids, renal capsule, renal papilla, renal cortex, minor renal calyces, and then major renal calyces, which joins to form the renal pelvis and drains into the pelvis. And then there is the inner structure, that is the renal medulla. Outer covering, basically outer portion of the kidneys is the renal cortex and inner portion is the renal medulla. Then arterial supply of the kidneys. The kidneys are highly vascular organs, receiving about 20 to 25% of the cardiac output at rest. Each kidney is supplied by a renal artery branching directly from the abdominal aorta. Inside the kidney, this artery divides into segmental arteries, which further divides into interlobar arteries. Then they divides into arcuate arteries, and arcuate arteries further divides into interlobular arteries before forming the capillary network of the nephrons. Venous drainage follows a similar pattern, with renal veins ultimately draining into the inferior vena cava. This is the whole things which I have mentioned previously, how this renal artery gives branches, which subsequently divides into segmental, then interlobar, then arcuate, and then interlobular arteries. This is the detailed arterial supply shown in this picture. As you can see that how renal artery gives branches, numerous branches, first segmental, then interlobar, then arcuate, and then interlobular arteries. And venous drainage is also depicted in this picture. What is Brodal's line? There is a avascular area or plane of the kidney, which is known as line of Brodal, which is an imaginary line along the lateral and slightly posterior border of the kidney, which delineates the segments of the kidney supplied by the anterior and posterior divisions. It is important access route for both open and endoscopic surgical access of the kidneys, as it minimizes the risk of damage to major arterial branches. As you can see that Brodal's line, it is a avascular area of the kidney, and whenever we are we puncture the kidney, or we are performing percutaneous nephrolithotomy procedure, and when we put LP needle in order to puncture the kidney, we should have to keep this line in our mind. Otherwise, if we puncture the vascular plane of the kidney, then there will be significant hemorrhage, leading to the postponement of the procedure, and procedure will be abandoned. So we will have to look for this Brodal's line before puncturing the kidney while doing any endoscopic or open procedures. Here it is the Brodal's line. This is the Brodal's line, avascular plane of the kidney, shown in this figure. This picture also depicts Brodal's line of incision, as there is posterior calyx of the kidney and frontal plane, and between these areas there is Brodal line of incision. And whenever we are puncturing the kidney with the LP needle while performing percutaneous or open procedures, we should have to keep this line in our mind. This picture also depicts the Brodal's line. This picture shows the vascular supply, arterial supply, and venous supply of the kidneys. Arterial supply shows how abdominal aorta gave branch of, in the form of renal artery. Renal artery further gives segmental branches, then interlobar, then arcuate, then interlobular. Then they form afferent arterioles, then glomerular capillaries are formed, then efferent arterioles are formed, and they form vasa recta and peritubular capillaries. And then peritubular venules drains blood into interlobular vein, then arcuate vein, then into interlobar vein, then into segmental vein, then into renal vein, and they finally drains venous drainage into the inferior vena cava. So this slide is about the venous drainage of the kidneys. Venous drainage follows a similar pattern, with renal veins ultimately draining into the inferior vena cava. Left renal vein is longer than the right because it needs to cross the midline to reach the inferior vena cava, which is positioned to the right of the midline. Left renal vein also receive tributaries from the left adrenal gland, left gonadal vein, like ovarian or testicular vein, and sometimes a lumbar vein. The right renal vein typically drains only the right kidney directly into the inferior vena cava. So this picture also depicts the arterial and venous drainage of the kidneys. Points to remember. The renal artery branches are anatomical end arteries. There is no communication between the vessels. This is of crucial importance as trauma or obstruction in one arterial branch will eventually lead to the ischemia and necrosis of the renal parenchyma supplied by this vessel. Then lymphatic drainage of the kidneys. Kidneys are drained by a network of lymphatic vessels that run alongside the renal arteries and veins. These vessels originate in the cortex and medulla, forming a plexus beneath the renal capsule. They then converge at hilum, the indentation on the medial side of the kidney, and drain into the lumbar or para-aortic lymph nodes. Specifically, right kidney drains into the right lateral caval lymph nodes, while the left kidney drains into the left lateral aortic lymph nodes. So this picture shows the lymphatic drainage of the kidneys, how kidneys drain into various lymph nodes. Nerve supply of the kidneys. The kidneys are primarily innervated by sympathetic nerves that form the renal plexus. These nerves originate from the thoracolumbar splanchnic nerves T10 to L1 and travel to the kidneys via the celiac and aortico-renal plexuses. While the kidneys receive sympathetic innervation, there is no evidence of parasympathetic innervation by the kidneys. So kidneys, point to remember is that kidneys only receive sympathetic innervation. So this picture shows the innervation of the kidneys, how renal afferent nerves supply the kidneys, and what are their various effects upon the kidneys in regulating the blood pressure via activating the renin-angiotensin-aldosterone system, by increasing the sodium retention, by increasing the blood flow, by increasing proteinuria, by increasing glomerulosclerosis. Abnormalities of the kidneys. Whenever we have to encounter about the normal structures of the kidneys, then we should also keep in mind what are the various abnormalities of the kidneys by birth. So there is first of all pelvic kidney. Pelvic kidney in utero, the kidneys develop in pelvic region and ascend to the lumbar retroperitoneal area. Occasionally one of the kidney can fail to ascend and remain in the pelvis, usually at the level of common iliac artery. Second is horseshoe kidney. A horseshoe kidney is also known as cake kidney or fused kidneys, where two developing kidneys fuse into a single horseshoe shaped structures, and by sharing the isthmus between the lower poles of the both kidneys are fused from the lower pole via isthmus. This occurs if the kidneys become too close together during their ascent and rotation from the pelvis to the abdomen. They become fused at their lower poles, the isthmus, and consequently become stuck underneath the inferior mesenteric artery. This type of kidney is still drained by two ureters, although the pelvises and ureters remain anteriorly due to incomplete rotation, and is usually asymptomatic, although it can be prone to obstruction. So here this picture shows the location of the pelvic kidneys. One kidney is ectopic, left kidney is at their normal place, while right kidney is ectopic and located in the pelvic area. This picture shows what is the anatomy of normal system and how horseshoe kidneys are connected. On the left side, horseshoe kidneys are connected by an isthmus. Both lower poles are connected with each other with a isthmus, and ureters are still normally draining into the bladder. So this is the horseshoe kidney, and first picture on the right side is the anatomy of the normal urinary system, how normal kidneys are located separately. Thank you very much for watching. Hope so all of you have got strong lesson. And so to summarize, the kidneys act as the body's filtration plants, the ureters as the transport pipes, and the bladder as a storage reservoir. Together they maintain the body's fluid balance and remove wastes effectively. A solid understanding of their anatomy is essential not only for exams but also for clinical practice, as urinary system disorders are common and often require anatomical insight for proper management of the disorders related to the kidneys and entire urinary tract. Thank you very much for watching, and thanks a lot, and best of luck to all of you.